When we began researching the changing role of an Irish community health worker, we decided that the best way to explore this was to speak to a community health worker themselves. So, I interviewed a woman named Kathy who has been a community health worker for the last 15 years. These were her thoughts. Their workload has undoubtedly increased. They used to work with both adults and children simultaneously. Now, they work with either group and swap every couple of years to maintain their skills. They used to be generalists, performing a kitchen sink type job, but with an increasing caseload, they can now only tend to strict nursing needs. They used to make surveillance calls to check on patients that no longer had nursing needs. Now, these patients must be discharged from the database. There's a distinct lack of community health workers. During the recession, there was a freeze on hiring. They are still feeling the effects of these losses. The ratio of patients is so high that community health workers do not have time to get to know them and cannot as easily recognise a patient's needs outside of their essential nursing requirements. As we know, in the healthcare system, there is a huge lack of resources. Due to a lack of beds, patients leave hospitals sooner and so sicker, making the community health worker's role more difficult. Twilight nurses used to make calls at night, filling the gap after 5 p.m. when community health workers leave. Due to a lack of funding, these no longer exist. Changes in society have also changed the role of a community health worker. People are living longer, and so community health workers are seeing many more complex diseases and cognitive impairment cases. Families are now working more, meaning a lack of a social network for isolated patients. The community health worker's role is now more important, as they may be the only company a patient has. There have also been some improvements when changing the role of the community health worker. Once a week, community health workers now work in specialist clinics, like a leg ulcer clinic for example. This reduces the number of patients being referred to GPs and to hospitals. So, as we can see, in keeping with any healthcare related job, the role of community health worker is ever changing and ever evolving.